Rahim. I'm Dr. Sayyid Raza Muhyiddin, member of the visiting faculty, Times Institute Multan, and this is the 13th lecture on healthcare system analysis, health policy and planning. And today we will discuss, very important topic of essential content of district health plan, document, planning cycle and glossary of terms. So in the previous lectures, I have told you about devolution and then the planning and budgeting process. I've told you, and of course the health sector reforms and health system of Pakistan. This topic, basically all these three topics, these are contained in the toolkit of the district health governments. These were, made in 2002 by Keelman and the people, the system, and it consists of 134 pages. And this essential content of the district health plan document is a part of, and the planning cycle and glossary. These are the three parts of that toolkit. So you will also get the copy of the toolkit that I will post you separately, but these three topics I will tell you today. So this essential content of district health plan document, this manual has given a conceptual framework and all the steps relevant to the planning process, but the final output will be preparation of a district health plan document from the purpose of the outline which serve as model. Then this essential content of district health document at the number 6th in that toolkit needs, it contains the executive summary, plan period, planning team, priority, health problems, plan objectives and targets, major interventions, additional resources required, agency responsible for planning of implementation and monitoring, and possible risks and assumptions. These are the essential content list. Then you see there's an introduction. In introduction, there's a district profile, that is the setting of the district team of the economic, social, geographic, political and cultural ecosystem available, infrastructure and communication systems. Then in this district profile, there is a district demographic profile, what the population is of the different age groups and the education standards, socioeconomic condition. These are all the district demographic profile. Then is the nature and magnitude of community involvement. Then after the district population, in this content there is provincial policy guidelines. Then there is situation analysis. In this there is primary health problem, that is listing of major health problems overall and especially in the last year in terms of mortality statistics and morbidity statistics. You already know these statistics. And then is the sources of statistics must be indicated, that is either it is the last medical health need priorities, and then is the major secondary or contributory problems. So major problems underlying poor health need in the context of each major specific health problem. So these are listed according to age group, then the health problem, best estimate and estimated number of affected individuals. And in this age group, you see preschool children, women, then general population, etc. Then we see the status of health services, then the major health programs being implemented in the district, health inputs, sports services, management of and organizational services, health services outcomes, and health service achievements and deficiencies. These are this essential content of district health plan document. Then here is there these are the available service programs. Then on the other side of the health is you have to make the facility based services like whether they're general curative, antenatal, EPI, etc. Then there are outreach services, midwifery, EPI, CDC. So then there are referral systems. So this is the part of the essential content of plan, the document. Then external factors include influencing health services, environment, community characteristics, etc. Then there is a list of resources available for districts. You have to tabulate uh, available resources in terms of trained manpower, material, and money. Then is you have to there are planned intervention measures. In this section, you have to describe both objectives and targets as well as the inputs and in programs and infrastructures, etc. And you have to do it under the certain headings. And these are service activity objective and targets. So you have to see what are the service programs, interventions, and what are the improvements in change in the infrastructures which are in line of the program, and then a service facility program, distribution, etc. Then you have to see the support system objectives and targets. So strengthening the support system such as maintenance of and repair, transport, vital statistics, and service record systems, etc. So these are all the descriptions of essential content of district health plan, which is a part of the toolkit for the district health government. Then is the management and organizational objectives and targets. These describe the future management or organization functions and content regards in regard of strengthening of capacity building. Then is the inter or multi-sectoral collaboration objectives and targets, and then is the community participation objectives and targets. All these are the objectives and targets to be listed. Then are the strategies and interventions. For each plan objective, identify one or combination of interventions, and for each intervention, identify major activities. And then present the priority problems, objective strategies, major activities in a strategy framework. And then you have to list according to this the priority of the problem, goal, objective, strategies, indicators are source, and then the risk exemptions. So we have to tabulate all this in the prescribed manner. Then we have to see the activity metrics based on the identified interventions. Same I already told you. Then the step is of the monitoring and evaluation. It is the description of monitoring and evaluation system. Then is the problem monitoring such as vital statistics, program inputs, expenditure versus budget, staff performance, output, outcomes, and community involvement, if any, in the monitoring side. Then this is also tabulated in the form activities, measurable, variable, tools of verification, and then who will prepare the report, when, how, who will give the feedback. This all have to mention in the documented in the plan. Then is developing the plan of operations and timeline, which is known as Gantt chart. The Gantt chart is related with the in project management and even in everyday hospital management. There is a Gantt chart that starts from on the one side there is time, and on the other column it is the activity, because in one time so many activities are being performed in the projects and as well in the normal functioning. So you have to develop the plan of operations with timeline, that, or even this timeline can be in months and days, and of course for hours as well. Like in, in hospital management, we say that the at the 7 o'clock in the morning, the our sanitary and janitorial staff will enter. At 8 o'clock, the medical officers, nurses along, the night shift will go and the morning shift will come in. Then the other activities again, at 11 o'clock, the janitorial staff will work. At 1 o'clock, so will work. So this is the way the Gantt chart is. And in project management, you say what we will do in the first week or first month, and then in the next weeks, because so many activities of building, construction, and then the procurement of equipments and other things, they are to be carried out in the same time. And so this is the description of how these intervention will take place and at what time. Then say this is the, hey, there's the issue problem time, these are to be tabulated. Then this was the all about essential content of health planning document, and all this was the subheadings of the essential document. Now one of is the planning cycle is another, it, what is the planning cycle of that will be the district in the district health governments. So the plan, it is a systematic process which enables managers, providers to determine how resources are used in relation to achieving their goals and objectives. So it consists of a series of 11 steps. The first six steps are sequential and their positions should not be changed. The first six steps, you can't change the position, these are sequential. And the last five steps can be changed according to the needs of existing situation. And so these steps are, the step one is planning the planning. Whatever plan you have to make, you first plan the planning. And that is to ensure that the planning process is carried out smoothly. It is imperative that the prerequisites for planning activity are in place and the issues relating to it are resolved. Then the second step is review of policy guidelines. Whatever the policy guidelines are given to you, you have to review so that a nice plan can be made. Then third is the situation analysis. The situation analysis is the process of analyzing and interpreting of information available from the various sources of information on the current situation. Situation analysis I have already told you in the previous lectures in detail. And that is the specific purpose is to identify health problems and health service needs. Then the fourth step is review of the resource availability. You have to just review that what resources are available to you for this plan. And the fifth step is the development of intervention. It is very important that this step involves to develop what is the appropriate intervention packages, that is, what is the strategy you need to resolve that issue or problem. So selection of intervention is very important. In the step 6, now is the setting plan objectives and targets. So you have to define what one wants to achieve and within the plan for period of time. So like in the basic definition of project, it is the within your resource and in that time, in the specified time you have to complete. So you have to plan the objectives and targets, you set it. And the seventh step is determination of resource requirements. Now you identify the resource requirement, and in this systematic process of transferring plan activities into resource needs, then you see what type of resources you will need to combat this plan. Then you have to identify the quantity of the need of the additional resources. Then in the step 8 is the adjusting the management and organization systems. So these are to just to coordinate center for all health services activities. So the main purpose is to ensure maximum efficiency and effectiveness of the healthcare delivery system. Then in the ninth step of planning cycle is the preparing of budget. So you prepare the planned budget is the process of translating required inputs and targets and planned activities into financial requirements, because all these activities will be needing different financial requirements. So the main purpose of budgeting, and I told you in the last lecture as well, to identify overall financial needs by the planned period, and then is the specific program and the source of funding as well. So you have to see how much the finance is needed and from where it will come, whether it will be provided by the federal government, the provincial government, the district government, some other funding agency, whatsoever it is. Then in the 10th step is the developing the plan of operations. Now you have seen the budgeting, you have developed the plan, you have identified the needs, and now is the what is the plan of operations. So a plan of operation is the written summary of the implementation plan, specifying main objectives, the results, and the activities. Then is the planning for, and in the 11th step is the planning for monitoring and evaluation. So monitoring and evaluation is a quality assurance mechanism and forms part of management and organizational responsibilities. So these purposes of monitoring and evaluation are to render healthcare as efficient and effective is possible with given ecological and resource constraints. So these are 11 steps. These are this a planning cycle, and it goes works in a cycle. And then the third topic here is the glossary of terms. In this toolkit, in the last item given is the glossary of terms. The different terms have been defined. These terms are used in the toolkit, so the definitions have been given, like the definitions of efficacy, that it is defined as the context to which a specific intervention or procedure, regimen or service. This is efficacy. So these processes to be resulted under ideal conditions. This is efficacy. Then efficiency is the obtaining the maximum output from a given input. Then in the same fashion, equity and equity in delivery of healthcare, equity in financing, these are defined in this glossary. And then a fair financing is defined, finance is defined, then it is defined that what is a health problem. That the health problem is a state of an individual or a community hindering normal activities, social, physical, economic development or employment. Then is the health promotion. Its definition has been given, that is efforts to maintain and improve the health of the individual or the community. Then health services utilization rates have been defined in this glossary. Health system review has been defined, input, outcome evaluation, impact, input, these all are defined. Then intervention is defined, it is specific activity meant to reduce disease risks, and then is the management is defined, needs, objective, outcomes, outputs, process evaluation, program. So these all are defined, which is already you come across when we were teaching all these terms. Then program budgeting is defined, a project is defined that healthcare activities that are being carried out on a pilot or demonstration basis. This is the pilot, this is project. Then public health is defined, that the discipline of medicine that deals with the health of the communities and countries rather than individuals. So in this way, then the recurrent cost, resource, situation analysis, these are defined, responsiveness, stewardship is defined, then strategy, target, technical efficiency, this is defined. So this is the long list of concepts are the terms being defined in this glossary of essential healthcare document. So I'll send you the full the toolkit copy of consisting of 134 or 136 pages, and that is very valuable book. And most the topics we told you, I taught you previously, you may also see in this toolkit as well. Thank you very much.